I am Dr. Samir Arbat, interventional pulmonologist from One Healthcare, Nagpur, India. And today I'll be discussing with you a very powerful tool of advanced lung care, that is rigid bronchoscopy. What is rigid bronchoscopy? Unlike flexible bronchoscopy, the rigid bronchoscope is a hollow metal tube which is inserted through the patient's mouth under general anesthesia and is useful for treating major airway conditions. When is it used? Rigid bronchoscopy is useful to remove large foreign bodies, blood clots, or thick airway secretions. It is useful for placement or removal of airway stents. Rigid bronchoscopy is useful for treating complex airway stenosis or blockages. It is an important tool for managing massive bleeding inside the airways. What are the advantages? It offers better control of the airways. It allows the use of larger instruments for treating airway disorders. It is the ideal tool for complex emergencies or high-risk airway procedures. What is the safety and recovery? This procedure is performed in the operation theatre under anesthesia. It is safe when performed by an experienced and trained specialist. Most patients recover in a day or two post-procedure. Closing remark: rigid bronchoscopy is an essential tool for managing complex and emergency airway procedures. Interventional pulmonology is transforming lung care and it is available here in central India. If you or someone you know is suffering from lung diseases, has unexplained cough, or require advanced lung care, this could be the solution. I'll be sharing more short videos related to these procedures. If you are interested, don't forget to like, subscribe or share. See you in the next video. This is Dr. Samir Arbat from One Healthcare, Nagpur, India.